All right, thank you, everybody. Welcome back from the break. I'd now like to introduce our next speaker, Dr. Robert, is it doctor? No, sorry, R.N.C., Robert Menkemeller. Robert started pursuing a study of health in 1989 by reading the book Life Extension by Dark Pearson and Sandy Shaw, an 868-page book. He met his first mentor, Dr. Ken Johnson, an orthomolecular nutritionist in 1990, which ignited his first passion and pursuits in natural health. Dr. Johnson encouraged him to become a nutritionist in 1992. From there, Robert started his first company in April 1995 by purchasing the school he attended. The school, Nutritional Science, was a California-approved private and post-secondary educational institution that trained individuals to become nutritionists. Wanting to provide tools for his students to better assess their clients' needs, he pioneered 2 web-based nutritional software programs in 1997. He sold the school in 2002. Robert met Raymond Francis, an MIT-trained chemist, in 1996. Raymond became a friend and his second mentor. Robert helped Raymond run his company, Beyond Health, 2 different times. Robert also assisted in bringing Raymond's first book, Never Be Sick Again, to market in September 2003. And maybe I'll just leave it there, a little short on time, and let you take it from there. Welcome, Robert Menkemeller. Thank you.
All right, so the question is, in fact, if you can hold the mic and grab 1 or 2 people, what is health? Anybody have some ideas of what health is? Just a quick idea. What is health?
It's a feeling, it's a concept, right? It's kind of like love. It's a concept everybody believes they understand what they are talking about, but in fact nobody has any idea, right?
Okay, I like that. Very good. One more.
Absence of disease. Absence of disease.
I think that's kind of the standard thing that we get from people. So, vitality. Okay, great. So, what do you do with these things? You have a feeling. Okay, what do? You have vitality. That's a good thing. If you have a lot of energy, that's great. My thing in actually Dr. Jaffe was Raymond's mentor kind of in his early stages, and I'll tell you a little bit about Raymond's story here. Interestingly, when I was working with Raymond, he was talking about a study in Europe that said health ranked number 47 until somebody got sick. And then when somebody gets sick, it becomes the number 1 thing. So it's kind of an interesting flip that we need to really kind of shift. I mean, I think most of us here are proactive and interested in our health, but we got to get the rest of the nation, because you saw some of the stats with Dr. Jaffe that he put up that are really frightening as far as Medicare and this whole thing about our health care and the way we're going to take care of somebody is somebody in the bed next to us is sick, and then we're sick and we take care of each other. That's going to be a tough time for us. So I like to take the complex and make it simple, and luckily meeting Raymond helped me do that. Raymond's story is he almost died. He was an international business consultant, 46 years young, feeling tired, chronic fatigue, multiple chemical sensitivities, and he visited 15 medical doctors. The first one gave him a prick test on the back. That gave him a further decline in health to where he went to 21 more doctors. He didn't know what else to do. He was a business consultant. He wasn't a nutritionist or a health practitioner or anything like that. This 36th doctor gave him a prescription medication, poisoned his liver, put him flat on his back. So the first thing he found out, and after going to 36 medical doctors, he decided, I better figure out what health is, because after 36 doctors, you think they would have helped me, right? And not only that, but the 36th doctor said, there's nothing more we could do for you. You have about 6 months to live. Go home and pack your things. And he was 46 years old, so he's like too young to pack his things up and move on. So that was his 6 months to live. Nothing more we can do. So he was an MIT-trained chemist, and he had to use his biochemistry and then work with other experts like Dr. Jaffe. Dr. Jaffe's vitamin C was one of the first things he did. Found it was a liver metabolite. taking the vitamin C from Dr. Jaffe. Within 48 hours, he's able to lift his head off the pillow, and then it took him 2 years to regain his health. So, what is the potential for health? Do you expect to be sick? Is disease a matter of bad luck? We all know that's not true. Is your longevity a matter of good fortune or good genes? You know, I asked my aunt once, who my grandmother died of cancer, so my mom and her had this fear of passing away of cancer. And I said, how much do you think genes affects your health? And on a scale of 100%. And she actually said 75%. So that to me, it's kind of like, you don't have much choices. The Center for Disease Control says it's about 18%. I think with epigenetics and what we know now, it's maybe 5%. In 1961, an article in JAMA reported men in Hunza lived to be 120, 140 years old. And Dr. Jaffe brought up Moses. I think he was like 500 when he died or something. So I think we've gone backwards. Maybe we'll find out and we're starting to find some of the good things, the predictive biomarkers, which I think is really important for us as well. And they lived to 120, 140 with great energy and good health. So that's the potential for health that we have. I love Dr. Jaffe's scale as well that showed that, you know, we should go up and then we should maintain health. So what is health? What is a good structure of health that can help us make health simple and just give us kind of, I mean, Dr. Jaffe gave us a lot of information tonight. Did everybody take good notes so you can implement everything real quick? Yeah, that's the challenge. And you know, that's what I'm actually working on with the current company as well. So with Raymond's illness and what he came up with was kind of a new science of health and disease. And it's basically one disease. Keep it simple. The World Health Organization, if you go to their website, they say there's 11,000 diseases. Wow. How do you manage that? That's crazy. 2 causes of diseases. Dr. Jaffe alluded to it quite a bit tonight. Deficiency and toxicity. He mentioned both of those elements in his talk. And then 6 pathways. He also mentioned choices. So those pathways of choices that we have are a nutrition pathway, a toxin pathway, a mental or psychological pathway, a physical, genetic, and medical pathway. So all of those areas are areas that we're making choices in every day that are leading us to deficiency, where the choices aren't providing the nutrients that we need to function at high levels and make our cells function at high levels, or toxicity, where we're exposed to toxins and that's causing our cells to malfunction as well. So Raymond says if all of your cells are functioning optimally, it's impossible to be sick. That's amazing. I mean, if we can strive and work to know the choices that we're making are leading us to greater health or to disease, we have control. We have control over our health. And that's the mindset that I think, you know, needs to change, because I think, you know, all of us baby boomers that were raised on this model that don't worry about your health. You go to the doctor, he'll give you one pill and you'll be cured. Life will be wonderful. So I think that's kind of and when I worked with Raymond at Beyond Health, I'd hear a lot of people on the phone tell me, well, what's that one pill? Just give me that one pill and then I'll be cured. You know, it's a mindset of doing everything in all of the 6 pathways in order to maximize the health of every cell. So Dr. Frank Schallenberger, who spoke here as well, he says health is maximal cellular energy production. He's saying the same thing, only on the positive side. So you only have one goal: maximize every cell in your entire body. You only have 50 to 100 trillion of them, so you know, at least it's a concentrated effort and a concentrated focus. So deficiency, what is deficiency? One nutrient can cause disease. Most Americans have multiple nutrient deficiencies. Vitamin D, mentioned in Dr. Jaffe's talk. Vitamin C. I've actually done the flushes before, and I'm right around that 15 to 20 range there, so I got some work to do. K, E, magnesium, potassium, calcium. Those are some of the main deficiencies. And if one deficiency can cause disease, and we have multiple deficiencies, no wonder we have a chronic disease problem in America that's heading us down a path of the next, economic challenge. And, 25 years out, this scenario where, we're sitting next to our fellow human being who's sick and they're helping us and we're helping them. That's an interesting concept, not a good vision that I want to see in my lifetime. So it's really important to saturate the tissues to repair and rebuild cellular function. So a lot of people with this pill mentality is that I'm going to take that pill and then in a week or so I'll be cured. But it takes time to saturate the tissues. It's just like the magnesium part that he mentioned. Just because you take magnesium before you go to bed doesn't necessarily mean you're going to optimize your urine pH the next morning and make that change. No way. No, I know. Right, exactly. Yeah. So toxicity, cells are poisoned by something that inhabits proper function. We're living in the most toxic world that man has ever created. It's challenging not to, be exposed to toxins on a daily basis. The Environmental Working Group, how many people have heard of them? Yeah, great website. Report says over 200 industrial chemicals and pollutants are found in newborn baby umbilical cords. We're in a situation where we're born into a challenging health equation. So health is a choice. That's it. Every day we're making choices that leads us to greater health or to disease. There's a health and performance scale. The common cold, most people think, oh, I just got a cold, right? Well, that's an indication that you're not at optimum health levels. So you're in between. You want to try and maintain and push the scale towards optimal health, right? And, not get yearly colds. That would be the goal, not to have colds in winter. It's not something that just should be a normal thing where you just say, oh, it's winter, I got the flu, that's normal. It shouldn't be normal. We should have great health and peak health throughout our lives. So the nutrition pathway, the foods we eat, the supplements we take or don't take. I think, in this day and time, it's really important to supplement. And I would imagine that mostly everybody here is supplementing in their diet, right? Is there anybody that's not supplementing in here? Ah, interesting. Very good. So still believe food's enough. Very good. Okay, so most of the standard American diet consists of the big four: sugar, white flour, processed oils, and dairy and excess animal protein. So this is what contributes. It's more the toxicity side, but on an everyday basis, we're exposed to these diets. So the more you can control your food, the better off you are, right? I'm a bachelor, so it's not easy to control my food sources. To improve your lifestyle, begin by consuming diet real food. Dr. Jaffe gave a good example. No processed foods. Try and eat whole foods, walk the outer aisles of the stores, make sure it's organically produced, fresh, whole, and unprocessed. Most of the time it contains the nutrients that nature intended and is free of man-made toxins. But one of the challenges with our food sources these days is, like he said, we're not picking the food at optimized, ripened levels, so we're missing a lot of the nutrients that's coming up through the ground into the foods. In fact, he mentioned magnesium, potassium has dropped over the last 15 years down to where we're getting half, if even a quarter of magnesium and potassium in our foods. And then meat sources that are as clean as possible, grass-fed, or get fish from clean sources. Have you heard of cleanfish.com? Good site. Good one. Supplements. Why supplement? As I just mentioned, the nutrient supply in food is down, and we're living in a more toxic world, so the need for nutrients is higher. Like as I mentioned, calcium in broccoli has been depleted by 50% since 1950, and demand is up given our environment and our exposure to toxins. The AMA is now even recommending a multivitamin. That's amazing. A baseline suggestion, not as complex as Dr. Jaffe's, but I use his his vitamin C, and his essential fatty acids. Throwing in the EPA, DPA is also great stuff. And then his Repair Guard is also a really good supplement too. I have a short 90-question deficiency quiz as well. If you want to write this down, this will give you a good idea of potential deficiencies. It's kind of like Dr. Jaffe's test. It's like takes you like 5 to 10 minutes, and it's automatic online, so you just answer 90 questions, and then it comes back with possible nutritional deficiencies, body parts affected, food sources of that. So if you want to eat more of those foods that have vitamin A or vitamin B, then you can get some information on that from this quick test as well. Oh. Got it? Okay. All right, so the toxin pathway. We're living on the most polluted planet man has experienced, and most of us know that. So we want to lighten the load, support your body's detoxification system by whole foods and specific nutrients. Another one of Dr. Jaffe's formulas is a detox formula. It's called PERK1. It's a formula of amino acids that help in a subtle detoxification way, and you can use it regularly as well. Regular exercise, and one of my favorites is saunas. Doing saunas to me is another essential element. So doing saunas, this is one of the things that really helped Raymond in his goal of regaining his health. Was he was doing saunas almost every other night because he was so full of toxins that he needed to detoxify his body. In fact, he said that he was so full of toxins that he could hardly pick up a new book. The ink from the text would just knock him out again. So it was pretty bad. Toxic overload results from small exposures each day from many sources, including this. You'll love this list. Breakfast cereals, deodorants, dry cleaning, exhaust fumes, furnaces, hair dye, hot water heaters, mattresses, newspapers, perfume, antibacterial soap, disposable cups, fire retardants, mothballs, particle board, plywood, permanent press clothing. It's amazing, to me, the capacity of the human body to function in the midst of the environment today. It's pretty amazing that we still do.
That was too quick.
Sunscreen, synthetic carpets, new carpets. A good thing to open windows and let the toxins burn off. Open the windows, try and get as much sunlight in there. You get a new car, you get that new car smell, you're breathing in toxins. Roll down the windows and make sure you burn off some of the toxins that are, up from the new car. The flame retardants in the pillows, new pillows that we're getting, that's another toxic exposure that we're exposed to. To me, the mental pathway is one of the most important pathways. We still haven't really gotten our minds wrapped around the incredible power that our minds have. It's the most, or least easily understood of the pathways, but we're getting there. I think there's a lot of great people out there, like the field of NLP and hypnosis and some of those things. It's come a long way. Just the placebo, right? A drug with no effect works because what people believe largely determines what we achieve. Another time when I was working at Beyond Health, there was an actual lady that called me, and she was actually taking a prescription drug that was a placebo. And they told her it was a placebo, and I was amazed that that was the case. Yeah. Wow, really? You know that it's just a sugar pill, but it's going to cure you. So 3 steps to help you harness the power of your mind to optimize your health and well-being is visualize your goals. That's a really powerful thing. I'm a very visual person, so I like to see things or visualize how things work. Set goals and use positive affirmations. One of the things that I like to do with my mind is if I have any physical pain or anything in the body that I'm feeling, I say, that's just my body healing. You know, one of the things about the body is it's always trying to return to homeostasis. Does everybody know what homeostasis is? Yeah, okay. Yeah, so help it along. Yeah, positive, thoughts and positive things that you're believing in your mind are very, very helpful. The physical pathway, another important pathway. How many of you have heard of rebounding? This is, to me, one of the best exercises that you could do because you're jumping up and down on these mini trampolines, and every one of your 50 to 100 trillion cells is being compressed. So how do you make a cell stronger? Is by putting stress on that cell, right? And on that muscle. You break down the tissue, but the cell gets stronger and stronger. So when you're rebounding, you're putting roughly 4 to 6 G's of force when you're bouncing up and down on your body. And another thing about it as well is, besides conditioning, heal, strengthens, tones the entire body, they say that 6 minutes of rebounding is equivalent to 1 mile of jogging. 2 minutes of light bouncing on a rebounder is enough to circulate lymph through the entire system, through your entire body. The lymphatic system doesn't have a circulatory mechanism. So the only way that you pump fluid through the lymphatic system is by contracting the muscle. So this is one of the greatest ways to circulate lymph throughout the lymph system. The bilateral body, why pain happens. So I had chronic hip pain for about 7 years, and I grew up with 2 chiropractors, so I'd go over and get adjustments from my uncles when I was growing up. And I went for about 7 years to chiropractors, and I actually still go to a chiropractor, but I would get relief for about 6 months, and then I'd go back to a chiropractor and see them for about three months or so, and then I'd be okay, and same thing, 6 months. I did that for about 7 years, and then I go, wait a second, I'm not getting rid of the problem. What's the problem? And so that's when I heard of a guy named Pete Egoscue. Anybody heard of him? And he's written several books, but he talked about bilateral function. So you have 2 shoulders, 2 hips, 2 ankles, right? So that should be in balance. If you have your shoulders tilted like this and your hips are like that, what's that going to do to the spine, and what about pain, right? So what you want to do is you want to have the balance between the shoulders, hips, knees, and ankles. And so I went actually to Pete Egoscue's clinic in Southern California and went through his whole program, and then wasn't consistent enough to do all the exercises that he wanted me to do. So about a year after that, I met Jean Couch. Anybody heard of the Balance Center in Palo Alto? It's another great resource. She teaches how to sit, how to stand, how to walk, and how to sleep in balance. Where do we spend 100% of our time? Sleeping, walking, sitting, and standing. Really profound information. Highly recommend checking that out if you have any physical pain, just to know, and it's still, I'm probably about 20-30% of the time conscious of standing in the right way or sitting in the right way, but just to know that that's available and that helps as far as overall health and overall function goes, and keeps you kind of growing on that level of minimizing or keeping away from pain, is an important piece of information. The genetic pathway. So, yeah, that's linked to the past and passageway to the future. It's great because we're getting more and more information around epigenetics. How many of you have heard of epigenetics? Awesome. So, by definition, a gene is a sequence of DNA that determines an inherited characteristic. genes determine such fixed factors as eye and hair color. Most genes activate only under certain environmental conditions. Genes are not a guarantee that something will happen, only the potential for something to happen. And they can carry a predisposition to cancer, gum disease, insulin resistance, or diabetes or obesity. Genes have the potential to invite disease, but what you do with your life and how your diet and lifestyle instruct your genes is more important to determining the story of your life. Whether or not we contract an illness is determined by instructions we give our genes. So if we don't like the results we're getting, we need to have the ability to change the instructions to the genes. This to me goes back to the mental pathway. Everybody heard of Dr. Bruce Lipton? Yeah, another great guy. So his idea is that the protein molecule wrapped around the DNA and RNA and how that communicates to the building blocks of DNA and RNA affects the expression of the gene. So I think we're still in the early stages of that, but I think that's another great, pioneering thing. But, I think kind of having this knowledge and knowing that we're not controlled by our genes, and genes also are like on and off switches, so we can kind of express the genes or turn them off just by, our lifestyle and how we're, so the epigenetics actually say you have the power over disease. You turn genes on and off through chemical, electromagnetic, physical, and mental environments you create, and a mixture of signals given by your environment, lifestyle, nutrition, and even thoughts determine how you control your genes. Provide the cells with the nutrients they need, keep them free from toxins, give them a supportive environment, and health-supporting genes are activated. Aging and disease-causing genes remain dormant, then both you and your cells remain healthy. It's all kind of along this structure of one disease, two causes, six pathways. That's the way I always think of my health now. Where are my cells malfunctioning? What's the deficiency? What's the toxicity? And which of the six pathways do I need to make different choices? So with the medical pathway, this is my favorite pathway. Everybody else like this path? Yeah. So healthcare so I mentioned this a little bit earlier, that we've been conditioned to believe that the doctor is always right. Most of the time, this is not true. For acute care, medical emergency, definitely go to the doctor. There was a period of time in my early years of study where I think I had a lot of disdain and disrespect for doctors, but I started going to assisted care places and seeing what doctors do, and then also when my mom was passing away, the drugs to keep the pain down and those things, there's definitely a place for medicine. Chronic illnesses, doctors have no solutions, but they focus on managing diseases by suppressing the symptoms. And it's like Dr. Jaffe said, we need to support the physiology. That's the key. And we need to provide the nutrients we need to function and optimize the health of every cell in our body. For chronic conditions, you need ultimate health care, which focuses on removing the causes. It's kind of an interesting thing, because I'd never thought of this, but working with Raymond, we have a basic law of cause and effect. And he actually told me once that medicine is based on junk science. So being a chemist and a scientist, what does that mean? And so we live in a universe of cause and effect. So we go through our lives making all of these choices, and then we expect to go to the doctor and have him give us a pill and wipe out all of those things that caused the disease in the first place. Interesting. So rather than managing your disease and keep you sick, you need something to make you well. Rather than attacking the body with toxic drugs and invasive surgery, we need to nurture the body with good nutrition and detoxification. So doctors have limited tools. Educate yourself before you follow the advice of anyone. We have a lot of resources here and, on the internet. There's tons of information as well. But, I think having kind of an underlying idea or a baseline of physiology and understanding of physiology of cells and systems in the body is really important to also, knowing what to do and what not to do when you're talking to your doctor. Doctors have a limited set of tools, obviously drugs and surgery, outmoded, ineffective, and proven to be dangerous at times. Just look at Vioxx and Fen-Phen, some of the drugs that have been approved by our FDA and then pulled off the market. Second opinion doesn't have to come from another medical doctor too. So, look at all your resources and all the people. I mean, it's great that the naturopaths and acupuncturists and all of the different, natural modalities are getting more and more popular. So that's a great thing. Usually better to seek ultimate health care rather than conventional medicine. So what I'm working on is a platform where we have a health education, short 5 to 10 minute modules with a gamification and an interactive mobile help. Because what I want to do is try and make healthcare simple. So one of the things that I did in my early studies of nutrition was I'd hear, oh, this supplement's really good for this, so I'd take that for a while. Oh, this supplement's really good for that, I'd take that for a while. And I never really looked at the full spectrum of what does my physiology need and what kind of protocol do I need to build and do and make choices on a daily basis to optimize my health. That's the goal, right? And so I'm working on this and also going to Dr. Jaffe's workshop on Sunday. He's lecturing to health practitioners in San Francisco, giving us a little bit more detail of these biomarkers. And so having data and having access to that data and being able to shift the choices, to me, it'd be great with technology to be able to automate, a lot of this process and then rebuild, reshift, make different choices and try and simplify. One of my challenges here with the thing is we have great speakers, but, for me, I'm not sure that I am able to execute on maybe 10% of what I learned through here. We have incredible world-class speakers here, but as far as taking the information and putting it into action, that's a challenge for me. I don't know how it is for most of you, but, that's something that I want to try and, make easier, is to help us to be able to make those choices and make those changes and implement them. I was into personal growth and still am to some level. I've always wanted to grow and get better in life and learn and continually improve my knowledge and improve my health. It's not a static thing where you just wake up, hit your head on the headboard, and you have a disease. It takes time. So you want to continually work on your health and continually maximize the choices that you're taking. It's a never-ending learning process. So that's what I'm working on, and that's kind of the overview of it. So if there's any questions, let me know. Thank you for your time and attention.
Any questions?
Okay.
Is your app in
Hold on, let me bring you the mic, please.
I just looked up your app and I can't find it. Is it active yet?
No. Still in the early stages of building more of the education side of it first. I'm also working with another company called DynoSense that is a company that has a device that's really impressive, and they'll be out in August. So I'm working to integrate with them to where when you have the data, then you can kind of reverse engineer that with the education. But so their device, you hold in your mouth, and in less than 60 seconds, it gives you 50, I think they're starting at 33, and they're up to like 50 to 54 health metrics. So in less than 60 seconds. And I think this is going to be a fantastic tool. So I'm looking to kind of integrate that in what I'm doing around the whole process, but I still have a lot of work. I'm still in the early stages as a company. And
the biometrics the industry is just exploding too. I went to Stanford University yesterday. They had this thing called Cool Products Expo. They had a chair you'd sit in. It would measure your your breathing rate, your respiration, and your heart rate. There's little devices you could put your fingers on. It would measure your heart rate, show your heart rate variability. It's exploding.
It is, and DynoSense is really on the cutting edge. I mean, they have blood pressure without a cuff, VO2 max, EKG. You know, it's just
Cool.
yeah, a lot of information.
Hold on.
No question that what you're talking about is definitely useful and stuff, but how do you go about kind of making it into a habit? Like I was trying for a few decades to talk to different people of my family about exercising daily and eating healthy. Like my mom, for example, 15 years I talked to her about that
Yep,
almost every day
yep.
until she got like a head stroke and stuff because she was eating too many cookies, and so now she's struggling with that, right? But like she still doesn't believe that it was caused by that behavior.
Right.
So how do you induce that kind of behavior? Because yeah, you're right, people need that, but how do they go about doing it?
Right. So in the gamification that I'm working on, there's a guy named Yukai Chow, and he's basically taken the psychology of, have you heard of B.J. Fogg? He's a behavioralist at Stanford, right? Robert Cialdini wrote a book called Psychology of Influence. So he's taken those things and implemented them into the gamification process. He wrote a whole book on it. So I'm working with him to try and kind of, you know, help that process. I think that is like the major issue, no question. But we also need the education piece as well, but it needs to be put in a way that really works. And I don't have the answer, but I'm very interested in the behavioral change field and implementing that, you know, in the equation of this ecosystem of a health education, healthcare system type of.
Well, I was in an ideal scenario because I read the books you mentioned before, like I read the Cialdini and I know Fogg, right?
Yep.
And my mom trusted that I give her the best advice, and yet I was not able to induce that kind of behavior. Like even though I try really hard.
Yeah.
So that's why I'm very curious how you're gonna, because to me that's the key thing. Like if you can do that, everything else it's okay.
Right. Yeah, that's true. But I think we're still in the early stages of this behavioral change thing there. I don't have an answer for that, but I'm very interested in that equation. If that's something you're working on, I'd love to talk with you a little bit more. But yeah.
Working for myself, but I give up to work for other people.
Yeah.
My personal experience, my phrase for that is real permanent behavior change is hard. People don't do it unless they really see a benefit to it. So somebody was maybe shocked, I don't say, I eat bacon and egg every morning, okay? And I mix all the bacon grease in with the egg and I eat that all because I'm out for a ketogenic diet and I want to eat as much fat as I can. You know, my CRP is 0.1. Be that maybe, you know, sample of one, take that for what it is. But so I think people have to, like you say, experience a real benefit. So if you ever actually get into ketosis and you have the experience of ketosis and you notice that colors look more brilliant, you're actually stronger, that you feel better, then so I think you have to, whatever you're doing, when you experience the real benefit, and hopefully it doesn't take too long to start experiencing some benefits, because like Dr. Jaffe said, if the distance between whatever you do and the consequence is too long, then people don't get it. It's hard.
But the problem is these people
Hold on.
experience benefits. Like for example, they experience the benefit of eating cookies, for example, right? So for them, that benefit is much stronger than the ketosis. Like I also run, so I know what you're talking about. Ketosis is something, right?
Yeah.
But how
Keep-
about eating
Mike.
cookies versus
Well, the problem with cookies is that sugar is basically stimulating the same centers in your brain. The fructose stimulates the same centers that cocaine does, and that's a problem. That's an addiction response, and that's problematic.
Yeah, you know, it's a major challenge, and I think it's part of the human condition. And I think that you know, I mean, you know, I have perfection disease. I remember in 1990, I was waxing the back end of my car, and I had this little black speck on there, and I had to rub off that little black speck, and then I realized that I've got perfection disease. You know, cells malfunctioning in the brain. I mean, really, is it that important to have a little speck on the back? So that whole process there, I think, is one of the hardest things for us humans to do, is to stay consistent with things, but there's a whole motivational process behind it. And I think that we're starting now to understand this, and you hear behavioral change and all those things, but I haven't seen anybody out there that's really gotten it down to a point, especially in the health, but I think we still need a lot of major health education combined with the behavioral modification stuff to really make things unfold.
You're fighting drug response, you're not fighting rational.
That's true, and that's why the 6 pathways are important, because you have to, consider the mental pathway, but you also have to consider the nutrient deficiencies. B12 was a known deficiency for schizophrenics. And so, if they're deficient in several nutrients and they're not functioning at peak levels, then, it's not going to really help as far as the behavioral change side goes. So I really am passionate about the behavioral change for myself, as well as, just trying to get more people to make better choices and move in a healthier direction. Because, Raymond said too, and there's a video on my LinkedIn profile of Raymond talking about the next 800-pound gorilla, which is, this whole economic challenge of Medicare just being overburdened and we can't take care of ourselves. Just the disease, train that's coming down the road is going to be another economic challenge for Americans, so, and the whole world. So.
And on that cheery note,
Yeah. Maximize the health of yourselves.
thank you again, Robert.
Thank you.
Okay. That concludes our evening. Thank you very much. Our next meeting is May 19th. Again, I hope to see you then. Third Thursday of each month. May 19th is our next. Good night.